Welcome to day 3 of our bootcamp series. Today we are swinging into action. We are tackling the ring bar challenge of the course. Just like navigating these rings, understanding the roles and responsibilities of healthcare providers and workers' compensation requires precision and a firm grip on the details. Each role is like a ring. It's connected, essential, and part of the bigger picture. So let's swing through today's topic as we break down the key responsibilities that support the workers' compensation system. The learning objectives for today focus on exploring how healthcare providers participate in the workers' compensation system. We'll break down the distinct roles for each provider so you'll clearly understand how they work together. And we'll cover the key responsibilities providers have, ensuring the proper handling of workers' compensation claims. By the end, you should have a solid understanding of how these roles work and how they partner with each other to help injured employees. As we emphasize in all of our educational presentations, our main goal is to inform and educate you. This presentation is for educational purposes only and provides general information to help you navigate the system. It's important to remember that it's ultimately your responsibility to understand and follow the relevant statutes and rules. These laws and regulations play a key role in resolving disputes and complaints, so I encourage you to familiarize yourself with the Texas Insurance Code, the Texas Labor Code, and the Texas Administrative Code. Today we'll be focusing on the key definitions related to healthcare provider roles and responsibilities. We'll also go over the basic qualifications for participating in the system, the roles each type of doctor plays in managing the care of injured employees, and the general responsibilities of both doctors and healthcare providers. Let's start with discussing healthcare provider requirements. Before I joined the Division of Workers' Compensation, I worked in healthcare, and one of the first things that I noticed was that many of the terms that I used in the clinic had different meanings in the workers' compensation world. For example, the term healthcare provider in workers' compensation refers to both individuals and facilities. A healthcare facility includes hospitals, emergency clinics, outpatient clinics, and other facilities that provide care, which is similar to how it's usually defined. But the term healthcare practitioner in workers' compensation is a little different. It includes not just licensed individuals providing care, but also non-licensed individuals who work under a doctor's supervision. This unique distinction shows how the language in workers' compensation can differ from general healthcare. If you want to dive deeper, you can find these definitions in section 401.011 of the Texas Labor Code. To participate in the workers' compensation system, healthcare practitioners must meet some essential requirements. First, they must have an active medical license in their jurisdiction. If they're unlicensed, they can still participate, but only under the supervision of a licensed healthcare provider. In Texas, practitioners also need to file a financial disclosure with the Texas Department of Insurance in the Division of Workers' Compensation. Plus, they can't have any disciplinary orders that would restrict their ability to work within the system. These requirements help ensure that practitioners are qualified and compliant with the system standards. What is the purpose of financial disclosure? Financial disclosure is all about ensuring transparency and preventing healthcare practitioners from making unnecessary referrals to providers they have a financial interest in. This helps ensure that any referrals to associated entities are appropriate and ethical. Financial disclosure also applies to compensation arrangements. This includes any payment arrangement between a healthcare practitioner or their immediate family and a healthcare provider. Practitioners need to file a financial disclosure with DWC if they refer an injured employee to a provider they have a financial interest in. This must be done within 30 days of the initial referral, unless it was already disclosed. If you're looking for more details, the division has a webpage with examples and instructions on how to file financial disclosure information in the TexComp system. You can find this under F in the Workers' Compensation A through Z section on the division website. The division has the responsibility of overseeing the workers' compensation system and making sure everyone, including healthcare providers, comply with regulations. When any noncompliance is discovered, the division can impose various actions, which can include restricting providers from treating workers' compensation patients. There's a list of healthcare providers with restrictions available on the division's website. You can find that in that A through Z section by going under D for doctors not treating. While these providers may still be able to practice, these restrictions might limit certain services that they can provide. For example, one common restriction is not being allowed to serve as a designated doctor. And those are doctors that are specially trained to perform exams and help resolve disputes within our system. It's worth mentioning that our old statute previously included an approved doctors list that was abolished back in 2007. Any doctor who was removed or denied from that list is still considered sanctioned unless the commissioner were to state otherwise. So I've mentioned a few of the roles that doctors can have in the workers' compensation system. If you're familiar with general healthcare terms, these roles might seem a little confusing at first. So let's break it down and take a closer look at the specifics of each role. First, there's the treating doctor. This is the doctor who is primarily responsible for coordinating treatment related to an injured employee's compensable injury. You want to think of this doctor as the gatekeeper of the injured employee's treatment. The initial doctor who provides care to an injured employee is considered the employee's initial choice of treating doctor, although that's not always the case, and we're going to get into that a little bit further into the presentation. Next, we have the referral doctor. This is the doctor who steps in to examine and treat the injured employee at the request of the treating doctor. Then there's the consulting doctor. This doctor examines the injured employee or reviews their medical records at the request of the treating doctor, a designated doctor, or even the division itself. The designated doctor is assigned and specially trained by the division to recommend a resolution for disputes regarding an injured employee's medical condition. These doctors can be requested by the insurance carrier, the injured employee, or upon the request of the commissioner. The required medical exam doctor evaluates the injured employee's condition at the request of the insurance carrier or the division, though it's usually the insurance carrier who does request this exam. Required medical exam doctors provide an unbiased assessment of the employee's medical condition. And lastly, there's the peer or utilization doctor. This doctor performs an administrative review at the insurance carrier's request without physically examining the injured employee. They must remain impartial and have no known conflicts of interest with the employee or the healthcare provider whose care is under review. So that summarizes the different roles that doctors can have in the system. But according to the Texas Labor Code 401.011, a doctor is defined as a licensed and authorized doctor of medicine, osteopathic medicine, optometry, dentistry, podiatry, or chiropractic. To practice in Texas, they must hold a valid Texas medical license. While other practitioners like physician assistants and nurse practitioners can treat injured employees, they don't meet the legal definition of doctor under the statute, and they can't be officially assigned as the treating doctor. It's also worth noting that there are also a lot of healthcare systems that don't recognize chiropractors as doctors, but the Texas Labor Code does. Chiropractors are fully recognized as doctors within the workers' compensation system and can serve as treating doctors. So we've gone over and defined what each doctor role is. Now let's delve into the responsibilities for each of these providers that are outlined in Texas Administrative Code 180.22. All healthcare providers in the Texas Workers' Compensation System must adhere to our rules, statutes, and policies that guide the system. This includes things like reporting required information, such as disclosing financial interests, and providing fair, unbiased evaluations of injured employees' conditions. Their medical opinions are vital to ensuring injured employees get the care they need when they need it. Providers are expected to stick to treatment guidelines and have honest, important conversations with employees about their care. Providers are expected to evaluate each case impartially without bias to maintain the integrity and effectiveness of the workers' compensation system. Healthcare providers also need to make sure that they're billing correctly by following the medical billing and fee guidelines outlined in Chapter 134. One key task for healthcare providers is to examine injured employees to determine when they've reached maximum medical improvement. Maximum medical improvement is defined as the point at where recovery is as complete as it will get, and the injured employee has reached maximum recovery from their injury. For some employees, this means a full recovery, but others may not get back to 100% pre-injury status. When this occurs, this is when the impairment rating may be evaluated. The impairment rating is a percentage that reflects the permanent impairment of the whole body resulting from the injury. Healthcare providers also need to comply with federal regulations like the Americans with Disabilities Act to ensure they're meeting legal requirements while providing the best possible care for injured employees. The responsibilities of treating doctors, referral doctors, and consulting doctors all center around providing the care that's reasonably necessary to treat work-related injuries. This means their job is to ensure the treatment cures or relieves the effects of the injury, promotes the injured employee's recovery, and enhances their ability to return to work in a productive role. Injured employees are entitled to all necessary health care for the duration of their claim. There's no cutoff of medical services, even after the employee reaches maximum medical improvement. It's worth noting that for claims or injuries before 1991, the old law allowed lump sum settlements for medical services. But for injuries on or after January 1st of 1991, lump sum settlements are no longer an option. Instead, injured employees are entitled to all medically necessary benefits for their compensable injuries. Now that we've gone over the general responsibilities of providers, let's focus on the role of the treating doctor. We'll take a closer look at their specific responsibilities within the Texas Workers' Compensation System and what sets their role apart from the others. Injured employees have the right to choose their treating doctor. Usually, the first doctor who provides care becomes the treating doctor. Now, for network claims, injured employees must select from the network's panel of contracted doctors, and those panels may or may not include chiropractors. If you want more information about the process of choosing a treating doctor, you can refer to Texas Administrative Code 126.9. There are some exceptions to an injured employee's choice of treating doctor. For example, if a doctor is paid by the employer or recommended by the carrier or employer, this may affect their choice. However, if the injured employee receives treatment from a recommended doctor for more than 60 days, that doctor can become their treating doctor. Another exception involves emergency room doctors. An ER doctor does not automatically become the treating doctor unless the injured employee continues to receive care from them beyond the follow-up treatment related to the ER visit. If an injured employee wants to switch to a new treating doctor and finds a doctor who's willing to serve as their treating doctor, they can request a change using the DWC 53 form. This form has to be signed by the new doctor and then submitted to DWC for approval. The form can be sent to us in a couple of ways. It can be uploaded into TexComp, It can be faxed or it can be mailed. And once we receive it, the request is reviewed and processed within 10 days. For networks or political subdivisions, and when I say that, I mean things like counties, sheriff's offices, or school districts. They may contract with healthcare providers or operate like a network. So you want to be sure to check with them directly to see if they have their own process or their own form for requesting a change of treating doctor. The treating doctor is responsible for overseeing the overall care of the injured employee, even if other doctors are involved. If the treating doctor refers the injured employee to a referral doctor, the referral doctor should be communicating back to the treating doctor on a regular basis. The only exception to this is in emergency situations. The treating doctor should be approving or recommending all health care. Again, everything ultimately goes back to the treating doctor to ensure they're aware of all the treatments and they can properly coordinate the overall care for the injured employee. One of the most critical responsibilities of a treating doctor is to assess and provide a professional opinion on an injured employee's ability to return to work. And that includes identifying any necessary restrictions. This evaluation is crucial, and the treating doctor needs to clearly communicate their findings to the injured employee's employer and the insurance carrier through a work status report, adhering to all relevant regulations. This step is essential to keep the process of care moving forward because income benefits often depend on the communication, which can have a huge impact on the injured employee's life. The medical opinion of the treating doctor is integral to supporting the mission of the workers' compensation system. The treating doctor is responsible for completing the DWC 73 form known as that work status report. You can bill for this using CPT code 99080 with a modifier 73 and receive a reimbursement of $15. While physician's assistants or APRNs can complete the form under proper delegation, the treating doctor is the one who is still ultimately responsible for this form's accuracy. The requirement for the 73 form is detailed in Rule 129.5. It's important to note that a work status report isn't required for every visit. If you've been submitting one at every visit, you may have experienced denials from the insurance carrier, and that's because payment is only authorized when the report is actually required. The 73 is needed during the initial examination by a treating doctor or a referral doctor. It's not necessary for emergency room visits, but once the injured employee visits a non-ER treating doctor or a delegated physician assistant or nurse practitioner, the 73 form must be completed and is required for that first visit. And then after that, a new report is only needed if there's a change in the injured employee's work status or significant changes occur in their activity restrictions. The rule also states that the treating doctor will be required to complete the 73 at the request of the insurance carrier, its agent, or the employer if the request is made through the carrier. However, this should not exceed more than one report every 2 weeks, and it needs to be based on the doctor's scheduled appointments with the injured employee. The report of medical evaluation, or the DWC 69, is another key form in the workers' compensation system, although it's not used as often as the 73 form. The 69 form is used when the treating doctor needs to determine the maximum medical improvement date for an injured employee. Unlike the 73, there is no separate charge or reimbursement for completing the 69. And just as a reminder, as of June 1st of this year, these exams can now be performed via telemedicine for this MMI determination, only for the dates of service after June 1st, of this year. The impairment rating can't be done via telemedicine. This is only for MMI. When an MMI and impairment rating are required, the treating doctor completes this form. Now, there are situations where the treating doctor may not be authorized to assign an impairment rating. In those cases, the treating doctor must first determine if the injured employee has any potential for permanent impairment. If so, the treating doctor must decide whether they're qualified to assess the impairment rating or if they need to refer the injured employee to a doctor who can. Detailed guidelines for this process are available in the Texas Administrative Code 130.2. Ultimately, it is the treating doctor's responsibility to establish the MMI and then determine the next steps regarding the impairment rating, ensuring that the injured employee receives accurate and comprehensive care throughout their recovery journey. If the treating doctor determines that an injured employee has no potential for impairment, they can certify maximum medical improvement without special training by completing the DWC 69 form with the MMI date information. In cases involving minor injuries where the injured employee is treated and released and is not receiving temporary income benefits, the treating doctor is not obligated to schedule an MMI examination. In these cases, the 69 may not be necessary, but if an examination for MMI is conducted, the 69 form should be completed to meet the submission deadlines. Instructions for this process are included on the second page of the form. If an insurance carrier requests the DWC 69 to certify MMI for a minor injury, the treating doctor can send the insurance carrier the latest clinical notes in the completed 73 form for the injured employee's condition and is not required to schedule and conduct an MMI exam. This is why clinical documentation is so important and should be detailed regarding the mechanism of injury along with pertinent history, exam, and additional findings. It's crucial to note that once an injured employee has been evaluated and reached MMI, they are still entitled to all medically necessary benefits for the duration of their claim. When another doctor assigns an impairment rating or certifies MMI, they're required to send the 69 form and any related reports to the treating doctor for their review. The treating doctor is not obligated to conduct a separate examination of the injured employee to confirm the MMI or the impairment rating. Instead, they should use their comprehensive knowledge and understanding of the injured employee's condition to make an informed decision. If the treating doctor disagrees with the other doctor's assessment, they must provide a detailed explanation for their reasoning to both the division and the injured employee within 7 days of receiving the 69 form. This ensures transparency and clarity in the evaluation process. When a designated doctor needs to give their opinion on maximum medical improvement or impairment ratings or other issues related to an injured employee, the treating doctor has an important role to play. The treating doctor is responsible for sending all relevant medical records to the designated doctor to ensure they have everything they need for a thorough evaluation. In workers' compensation cases, this can be done without a signed release from the injured employee, since these cases are generally exempt from HIPAA compliance. The designated doctor is authorized to receive confidential medical records to help resolve disputes. Along with the records, the treating doctor can include an analysis of the injured employee's medical condition, their functional abilities, and any potential return to work options. This information helps provide a comprehensive review to aid the designated doctor in their assessment. The designated doctor is required to notify the division within 1 working day of the scheduled examination if they have not received the required medical records, and then upon that notification, the division will then take the action necessary to ensure that the designated doctor receives the required records. But the treating doctor should ensure that the designated doctor receives those medical records no later than 3 days prior to the date of the designated doctor exam, as found in Rule 127.10. The treating doctor may bill and be reimbursed for those records from the insurance carrier, and you can find more on that under Rule 134.120 for reimbursement of medical documentation. There can sometimes be differing opinions about whether an injured employee has reached maximum medical improvement and what their impairment rating should be. In some cases, the insurance carrier might request a designated doctor exam for the injured employee to help resolve these questions. If the injured employee disagrees with the designated doctor's findings, they have the right to seek an alternate certification. This is an option if the designated doctor's opinion is the first evaluation of MMI and IR, and the injured employee isn't satisfied with the designated doctor's findings. The injured employee can then request a re-evaluation by their treating doctor or a referral doctor chosen by the treating doctor. This process gives the injured employee a chance to get a second opinion, ensuring that there's fairness and accuracy in assessing their medical condition and the impairment rating. The treating doctor can also offer an alternate opinion on various other issues, such as the extent of injury or the employee's readiness to return to work. The criteria for this alternate opinion is the same. If the treating doctor or referral doctor hasn't previously given an opinion on the matter, but the designated doctor has, and the injured employee again disagrees with the designated doctor's findings, then an alternate opinion can be sought. For more detailed information, you can refer to Texas Labor Code 408.0041, which covers the procedures and regulations for designated doctor examinations. This ensures that the injured employee has multiple avenues for fair and thorough evaluations, promoting a balanced approach to their care and their recovery. When there's a dispute about whether a workplace incident caused an injury or condition, the treating doctor may be asked to provide an opinion on causation. Causation is a medical opinion that outlines how and why the claimed accident or incident significantly contributed to the diagnosed condition that's being treated. A thorough causation analysis should include a brief summary of the examining doctor's qualifications, the injured employee's medical history, the exam findings, and an explanation of how these findings led to the doctor's conclusion. For more detailed information on causation analysis, you can go over to the website and navigate to that workers' compensation A through Z tab. Under that, you'll go to C to find causation analysis, and you'll find comprehensive resources on this topic. On our webpage, you will see that there is specific information that treating doctors can reference on how to write the causation statement. I would suggest that the medical documentation from the first visit explain the causation or the mechanism of injury, so that if necessary, the medical record can suffice in resolving any disputes regarding this issue. If the documentation is detailed from the first visit, a treating doctor may not have to write a separate causation narrative. The website does provide you with a sample report and best practices if your treating doctor is preparing one. This is one area that makes workers' compensation different from private insurance plans. The workers' compensation insurance carrier is only responsible for paying benefits for compensable injuries. There can be a great deal of scrutiny that can surround how the injury or the illness is work-related. The treating doctor should offer their expert, unbiased medical opinion on whether the diagnosis being treated was caused by a work incident or not. Sometimes this involves a tough conversation with the injured employee, but that's why we rely on the treating doctors for their expert medical opinions after thorough evaluation and history with the injured employees. That completes the responsibilities of a treating doctor. Let's discuss the other types of doctors in the workers' compensation system and their responsibilities. Referral doctors are specialists who examine and treat injured employees at the request of the treating doctor. It's important for the treating doctor to maintain open communication with the referral doctor. This ensures coordinated and comprehensive care for the injured employee. Referral doctors play a vital role in supplementing the treating doctor's treatment plan, and they should be providing timely and regular updates to the treating doctor, who again is ultimately responsible for overseeing all aspects of the injured employee's care. While there is no official referral form for non-network referrals, if you are dealing with network claims, you want to make sure that you are checking that specific network's guidelines on referrals. And remember that it's important to document any referral in the medical record. The treating doctor must stay informed about the referral doctor's findings and treatment plans. Additionally, the referral doctor should not refer the injured employee to another specialist without the treating doctor's approval. This helps ensure a cohesive approach to the injured employee's medical care. A consulting doctor can be brought in by the treating doctor, the designated doctor, or the Division of Workers' Compensation to examine the injured employee or review their medical records. This request is typically made to confirm the diagnosis and ensure the appropriateness of the treatment plan. Consulting doctors can assess the injured employee's medical condition, their work status, and their ability to work, and potential work restrictions as well. While they have the authority to examine the injured employee and suggest referrals or initiate treatment, they can only do so with the treating doctor's approval. If the treating doctor approves or requests that the consulting doctor provide treatment or health care, the consulting doctor then switches roles and transitions into a referral doctor, taking an active role in the injured employee's healthcare management. This collaborative approach ensures that the injured employee receives the most accurate and effective care possible. In our system, designated doctors are appointed by the division to provide expert opinions on disputes regarding an injured employee's medical condition. Their assessments are crucial, and they can be used in legal proceedings. These doctors undergo specialized training to understand the workers' compensation system and how their role affects injured employees. To become a designated doctor, they must first complete training and testing and apply to then be included on the division's official list of designated doctors. They are required to update their training every 2 years, although they only need to test once under the new system. With the recent increase in reimbursement rates for maximum medical improvement and impairment rating evaluations, becoming a designated doctor is now both accessible and more rewarding. Required medical examination doctors are typically chosen by the insurance carrier, and in some cases by the division, to conduct an impartial evaluation of an injured employee upon request. These evaluations are often sought when there's a dispute or when the insurance carrier wants a second opinion on issues like MMI or the impairment rating or other claim-related matters. Usually, a designated doctor must conduct the initial examination before an RME can be requested. If an RME is requested before a designated doctor exam has happened, the RME doctor can only assess the appropriateness of care. If the request is made after a designated doctor exam, the RME doctor can evaluate MMI, IR, disability, any return to work statuses, and other relevant issues. The RME doctor does not make referrals or initiate treatment without the treating doctor's approval. In most cases, the RME doctor is focused on evaluation rather than treatment. If desired, the treating doctor may attend the RME exam if the injured employee requests that they're there and the treating doctor agrees. For more details about RME exams, you can go under Texas Administrative Code 126.6. Peer or utilization review doctors don't conduct in-person exams. Instead, they perform detailed administrative reviews on a prospective, concurrent, or retrospective basis. Their job is to evaluate the medical necessity and reasonableness of healthcare services, ensuring that the care provided is appropriate and justified. UR doctors review the appropriateness of care, which may occur as part of the utilization review process. They can also be asked by insurance carriers to assess other issues not related to medical necessity. To carry out these reviews, UR doctors must be licensed in Texas and hold proper credentials. Additionally, they must be registered with the Texas Department of Insurance, as part of a recognized utilization review agency. All right, so that summarizes all of the doctors. Let's do a quick recap of what we have covered today. We talked about the key definitions related to healthcare provider roles and responsibilities, the basic qualifications for participating in the workers' compensation system, the roles each type of doctor plays in managing the care of injured employees, and the general responsibilities of both doctors and healthcare providers. So now we've reached the fun part of our boot camps, and this is the Train Your Brain section. This is where we put up 5 polling questions for you. Let's go over those questions. First question was, what type of doctor manages the overall care of injured employees? That is the treating doctor. Remember, this is the gatekeeper. Everything goes back to the treating doctor. They coordinate the overall care for the injured employees. Number 2, healthcare practitioners must have an active medical license to practice in their jurisdiction, or if unlicensed, be under the direction or supervision of a licensed healthcare provider. That is true. It looks like a majority of you got that one correct. Number 3, generally, the first doctor who provides healthcare to the injured employee is considered the employee's initial choice of treating doctor. That is true. Normally, the first doctor will default into becoming the treating doctor, but there are those exceptions, and that being emergency care. So keep in mind that generally they default into the choice of treating doctor, but there are exceptions in that. Number 4, a referral doctor supplements the treating doctor's care and can only make referrals with the approval of the treating doctor. That is true. That referral doctor supplements the treating doctor's care, and they go to the treating doctor to have that conversation and make sure that the treating doctor is on board with any recommendations that they have. And number 5, when another doctor assigns an impairment rating or certifies maximum medical improvement, they must forward the DWC 69 form and any accompanying reports to the treating doctor for their review. And it looks like a majority of you got that one right as well. That is true. Thank you so much for participating in that with us today. That's fantastic. Well, you guys seem to have crushed this ring bar challenge of the course. Great job. But don't get too comfortable, because in our next challenge, which is coming up fast, our next boot camp session, we're hitting the running portion of the course, where we're going to be focusing on identifying workers' compensation patients. This is where the groundwork starts. We'll train you on how to spot those critical details to identify workers' compensation patients and verify you've registered them correctly to keep those billing denials at bay. You want to think of this as your endurance test in the workers' compensation world, staying sharp, staying fast, and staying ahead. So I hope you rest up and you hydrate and get ready to run. And we see you at the next session. If you have any questions, you can always contact us at CompConnection by email or phone. We are happy to help you with anything that you need help with. Thank you so much for joining us today.